Hey, thank you. Thank you, one and all, and thanks for joining. First of all, very good morning and good evening from wherever you have joined. Thanks for joining the session. And as you all know, today we will be talking about transforming the patient experience with the next-gen technologies. So to give a quick introduction, and before I start with the introduction, the plan is to talk about the introduction and then introduce the speaker, and then we will talk about the different discussions on the topic of the fireside chat, and then we'll have a separate Q&A sessions. Like today's primarily talk will primarily center on how to boost the patient experience. Why patient experience? Like we everybody is talking in the healthcare market about the big data, AI, ML, and all that. But yes, but why are we doing all this? The whole idea is to how do you enhance and boost the patient experience. So in this sense, it's not at all fancy though. So we will discuss the ways in which today's technologies can propel the experience of tomorrow's patient experience. So that's the topic. Uh, so, not taking much time, let me quickly introduce you all to our speaker, the guest today. Hey, Dr. Nihal, very good morning.
Hey, nice to be here. Thank you so much for having me.
Yeah, thanks, Dr. Nihal. So, as you all know, in this fireside chat, we have an expert from healthcare industry, is Dr. Nihal, and he is a principal application and enterprise architect at AccentCare. And AccentCare is one of the leading healthcare companies in US in the post-acute care space. It's into home healthcare, hospice care space. And he has championed advanced optimization techniques and machine learning in decision support systems for the global companies with a specific emphasis on human interface, design, UI, and UX. And he's also an author of Quantum Computing, which is program next gen computers for the heart and real world applications. Welcome again, Dr. Nihal.
Thank you so much, Shridhar.
Yeah, and before I start, I'll just quickly introduce myself as well. I'm the host for today, and myself, Shridhar Purohit. I have around 18 years of experience in only into healthcare IT, and I have worked on all the areas of IT healthcare, which is right from your payers to providers to patients, life sciences. So currently, I'm working as the head of offerings with Tietoevry Healthcare Department healthcare business unit. So this is about me. Moving on, quickly, before we start the actual topic, today Dr. Nihal will share insights on how next-gen digital technologies can help to solve the healthcare challenges and enhance the patient experience by connecting the three Ps. The three Ps are the patient, payer, provider of healthcare. So we will also discuss on how to provide an optimal customer experience, the patient experience, and the organizations and the people who have joined today and who will be looking at this will can leverage this as part of their growth strategy. So we look forward to all of your participation, active participation by asking the questions, if any, in the chat box. With that, let me not quickly take time. We'll start with the fireside chat. So welcome again, Dr. Nihal. We'll start with like because you spoke about we know that you are from the healthcare background, and so we wanted to know what made you to get into healthcare and how did you get into healthcare?
Yeah, thank you, Shridhar. I'm delighted to be here and talking to you all. So I've spent most of my last 25 years building complex applications in industries such as the airlines, railroads, finance, automobiles. But I started getting interested in healthcare with the advent of a technology HTML5. In specifically, I realized that the HTML5 canvas offers unprecedented potential in showing DICOMs, the MRIs, CAT scans, PET scans natively on browsers without the use of any additional plugin. So you don't require any sophisticated, devices costing tens of thousands of dollars to start seeing these DICOMs, but you can actually show it on the browser. But what really got me interested in this topic was not just showing these DICOMs, they're taking something that exists outside the web, in these expensive machines in hospitals. But when you put it to the web, suddenly you can couple this with a lot of existing web technologies. So, for example, you can take these DICOMs and you can send it across the oceans to get second opinions of doctors, and all of that is just using the same kind of technologies that we use today for collaboration. So it's the combination of these two, the existing technology with the potential of the web and the power that the internet offers, and suddenly you get something that's a lot more than just one application. So the sum of the parts is less than, or the whole is greater than the sum of the parts. So let me just illustrate this with an example. So what I'm going to show you is this is an actual DICOM viewer. This is a CAT scan. It's it's an anonymized study, a CAT scan of the colon. But this is what you would see, with a radiologist would see on their machines. But now I can see the same thing on a browser. So I can do things like zoom in and out. You notice that there's no pixelation. It's all very smoothly working. The web offers that. But now that it's on the web, suddenly the patient has access to something like this. The patient can then route it to other people across the country to get, or around the world, to get second opinions. Um, the other thing that's exciting about the marriage of the internet with the devices today, most devices that a radiologist uses and the machine that they dictate their reports are two different. They're two different machines, and they're not the same. But here you have the same machine, and not only do you have the same machine, but interestingly enough, something that's really making the rounds in radiology circles is that very easily you can insert an image in your radiology report. So now you enhance that patient education. Instead of giving stuff that the patient barely recognizes, they get to see and with really what's going on with themselves. You can enhance this. Um, with something like the Hounsfield unit, which analyzes or picks up the different Hounsfield units, and our body has different units for things like tissues, blood, bone, water, air, etc. So the canvas offers image processing capabilities, so you can quickly scan this and start identifying blood, for example, where it shouldn't be. So as the images are taken on the device, the system can scan and see if there's any blood on any specific slice, and it can send an email or a text message to the radiologist to look at this right away, as opposed to piling it up and seeing it at the end of the day when the machines have taken it up. So you suddenly start getting a lot of things that you didn't get in the past. Ambulances, for example, their portable CT scans, they can take advantage of some of the stuff and send text messages to the hospital, way before the patient actually reaches it. So it's this marriage of technology, the existing technology, but you superimpose the internet stuff, and suddenly you get to see something that you never had before. So that's really what got me excited in healthcare.
Fantastic. Great to know about your journey in healthcare because I can relate myself along with you. I too hail from the healthcare world, having 18 years of experience. So great to know your journey in the healthcare too. Yeah, with that, because you spoke about the DICOM and some of the digital things into the healthcare. My next question would be like when one talks about everybody talks about healthcare today. You everybody talks about interoperability, digitization into healthcare. So, according to you, when one talks about healthcare, digitization in healthcare, where should one focus on first? Was the question.
Yeah, absolutely. Patient experience. There's no question about that in my mind. We have seen tremendous tremendous strides in healthcare, for example, with the mRNA COVID vaccine and a whole bunch of other stuff, deep brain stimulation. And there's so much going on in the healthcare. But in my mind, really the focus right now is the patient experience. We need to put the patient in the equation, and they need to start seeing for themselves with their hands and eyes what digitization really means. So for any transformation to succeed, we must articulate, what it means for the average Joe or Jane. Amazon wouldn't have become so big if they had worked first on building relationships with publishers. They had to start selling books online. People had to discover for themselves that buying books online works and that it works spectacularly well. Once you get that connection between the patient and the technology, that fuels the growth of other things that can happen. For any game-changing technology in healthcare, I believe the patient's viewpoint has to be foremost. But unfortunately, we are seeing the pitfalls of this lackluster emphasis to date with the patients. Today, for example, when we go to the airport, we get notifications that our gate has changed from 31 to 32. But when it comes to healthcare, whether you're making a routine visit with your primary care doctor or you're checking in for surgery, that experience today in the 21st century is still jarringly archaic, full of paper documents, talking to people, making appointments, over the phone, and nothing really takes advantage of this fully connected world. So I think that there are lots of applications in the healthcare where connecting the patient to the technology has a lot of potential, and and gaps that we can start plugging in as we look ahead.
Fantastic. Yeah, I completely agree with you, and I read your mind there when you said a lot of things has to happen, like innovation in the technology has to happen in the how in the patient experience of the healthcare space. So with that, relating to it, I my next question is like because we see in today's world, you take it airline because you spoke about the airline industry. You take it airline, you take it banking, you take it insurance. We see lots of innovations happening in the health in the technology space. So, considering that, my next question would be: what are some of the challenges facing healthcare that prevents this industry, healthcare industry, from rapidly uptaking the innovations which we are seeing elsewhere?
Yeah. So that's a great question. Let me illustrate this with something that we pretty much all have some familiarity with. Take, for example, our financial accounts. Today, the average consumer holds about 5.3 accounts in various financial institutions. You have an account, say, with Vanguard, with Fidelity, with so many different financial institutions. But many of them offer today the ability to consolidate your accounts from all these financial institutions and bring it into one place for you to see it. But now look at your healthcare records. Patient records arguably are one of the most important documents that any of us have, but they don't have a safe home. A large part of the reason for, in my mind, the sorry state of affairs is that our health records are not fully digitized. Very often our medical records are on piece of paper, on hard copies. And even when they are digitized, they are sitting in silos in different healthcare institutions, and we don't have an ability to bring them together. Now, financial records are simple. It's just numbers. It's basically text data that you can just collect and you can put on one page. But when you talk about healthcare, one of the big challenges in healthcare is that there are a wide array of formats. It's not just free form text, handwritten prescriptions, handwritten your handwritten doctor's notes, but you also have lab reports that are text-based. And then when you start talking about things like MRIs and CAT scans, those are an entirely different game. These medical images are a different format entirely. So if in order to bring all of this together, all of these multiple formats together is challenging to consolidate. But nonetheless, my view is that these are not insurmountable problems. We don't have to wait for any new technology to get all of this working. the Lego blocks are already in place. It's just a matter of building something to put it all together, so you can start seeing all your information in one place. So the fact that the basic medical information is in so many different formats is a challenge, but it is one that we can solve as IT professionals today.
Yes, completely agreed. And to add on to what you said, and uh, because the one more challenge which if I have to add here is everybody from the day one when the healthcare IT started, everybody talks about interoperability and challenges of interoperability. When I say interoperability, to put it in a simple way, if a patient A is going to EHR1 today, to hospital A which uses EHR1, and the same patient A, if he's going to a different hospital in different state of US, which uses EHR2, today again he has to go through the same cycle of giving all his demographic data, his so many health history and everything, and which is again a repeated thing with EHR3 as well. So even though we are talking about so many big things into healthcare, we still interoperability is being a challenge. So I think that is the focus, and those are some of the challenges which healthcare IT has to look into going forward. So with
Yeah.
that, and we all agree that healthcare is a unique industry, and there are wide and disparate demographics at a play in the healthcare industry, and there are also wide ranges in the skill levels of the patients. So, so in particular, my next question would be: how does the demographic of an aging population affect the adoption of the technology in the home health space? And the question is because you come from the home health space, so we want. I request you to elaborate on like this aging population affecting the adoption of technology into home health space.
Sure. So the typical home health patient is an elderly person, and someone who's probably not as comfortable with technology as the younger generation or users in other domains. So at first blush, it may seem that the home health patient base would not be a target audience for introducing technology. But I feel that that mindset is not correct. Alexa and Google Home have shown that navigation by voice is feasible. So, for example, voice, when used correctly, offers a powerful way to introduce navigation onto websites. So you're not really looking, you're not really asking someone who may have poor eyesight, who may not be comfortable with navigating websites, to start going into this tab and that tab and start making, say, an appointment, or they want to find the latest lab results, which is often tucked under so many different navigation items in a website that it's hard for someone to find. Why can't they just simply say, find my latest blood results, and that is shown to them? So let me just share with you an insight as to why this particular technology is going to, this demographic is actually going to become very important as we go ahead. So let me share this. Let me share this graphic that I'd like to show you. So look at this particular graphic right here. Today in 2016, 2020, we see that the adult population, 65 and plus, is a little bit over 15%. But over the next few years, this population is on an accelerating growth. So there's an almost a tremendous growth that's taking place over the next decade. And after that, it kind of peters out for the next 30 or 40 years. So this area right here of the graph is where you need to focus on. There may not be a lot of people that are old today. They may not be clamoring for technology, but each passing day, each year, the number of people that's going to be in this graphic demographic is going to grow. But is this not the aging factor that's going to hit us? The population that's over 65 today has grown up in an area where there's not been a lot of technology. So that population is okay with filling out paper forms, talking to humans, having someone help them with their stuff. But as this population ages, as the percentage of people over 65 starts increasing over the next 5 and 10 years, you're dragging in people that are today 50, 55 years old, in 5 years, the 40, 5 years old population that will start becoming old by 2030. That population is going to be of a very different demographic than what the population, the older population is today. They're going to demand digitization in healthcare. It's no longer good enough to tell them that, hey, where was your x-ray of something that you took 5 years ago? Where is your history of lab results over the last 10 years? They're going to ask, this stuff should all be digitized. But we don't have anything for that in place today for that demographic to take advantage of. So if we don't do anything today, that demographic is going to be a highly frustrated age group that's going to kick in, and that's going to make it very challenging for them as we go forward. So it's absolutely critical for us to take advantage of that growth factor and build applications for them.
Exactly. So yes. So to add on to that, we still see that there are population who still need help from the home healthcare spaces. There are population who still cannot take do their own day-to-day activities, go to the gym, or there are such kind of population where the still focus has to go on, and technology has to enable that, like providing services, field services. How do you automate the field services area? Or how do you automate the channelize the different home healthcare service providers and get the home healthcare turnaround time better? So that's the focus area, is what I understand from what you are talking about, Dr. Nihal.
You're right. Right.
Agreed.
Absolutely.
So yeah. So we know that how applications in the other industries can be adapted for healthcare, like your scheduling application and your airline applications into healthcare. We understand that part based on the discussions which we did. But do you see any applications in healthcare that can serve as a beacon to other industries, Dr. Nihal?
Yeah, absolutely. So healthcare has the potential to drive the penetration of technologies such as augmented reality and virtual reality. From being just novelties to actually be life-changing technologies for many people. So for example, look at what happened during COVID-19. During the early days of the COVID-19 pandemic, there was a tremendous need for respirators to be used. But we didn't have enough trained clinicians, enough trained nurses that could use these to learn how to use ventilators. And moreover, it was not just plugging in one patient to one ventilator. The challenge was, can you plug in six patients to a ventilator? That's the shortfall of ventilators that we had during the COVID-19 pandemic. So we had this desperate urge to train these nurses on that. Now, there's no way we can bring the nurses into a physical space in one area and start training them how to use it. But that's where augmented reality and virtual reality can come in big time. Nurses were trained on using these devices. And with virtual reality, they could actually pick up the tubes, the patient tubes, and learn how to plug it into the device. They could fiddle with the knobs, figure out exactly what the nurse's sensory experience should be, not just looking at a video, but using their arms and eyes and connecting all these things to get a much better training for how to use these devices. You look at virtual reality in another area. Today, for healthcare, for patients, boosting their social health is of primary importance. It's not just the surgeries that take place, but it is the social environment that they're in that can actually increase and augment their recovery. For a lot of home health patients, they're sitting in hospitals, they're sitting at home, they're by themselves. A virtual reality allows them to connect to their loved ones. And this connection that we may see in gaming applications actually has life-changing impact for these patients. There are a lot of companies experimenting with some of this, and we are beginning to see that by connecting patients to their loved ones, around the country, around the city where they live, and bringing them together in one environment, in one room, in a virtual reality room, can actually have measurable impact, something that you can physically measure with endorphins and see that they are boosting their well-being, and that improves their outcome. So I feel that augmented reality and virtual reality can usher in a whole new class of applications that prove themselves in the healthcare and can be a beacon for how they can be used in other industries.
Fantastic, fantastic. And the reason and when you spoke about the augmented reality and virtual reality, this added a lot of value because the market is looking at the trend in the market based on analysis recently shows that everybody now post at least from the post-COVID situation, there are multiple other applications of augmented reality, virtual reality, and most of the healthcare players are looking to that. With that in mind, we at Tietoevry, Dr. Nihal, I just wanted to add this point. We at Tietoevry are also focusing in that area, and we are seeing multiple other important use cases of VR and AR, starting from your because you spoke about the training and the how the patient experience. We identified some of the use cases like how we can enhance the pain management, how we can bring in the VR or AR kind of a concept into the different use cases like pain management, your education and training, which you just spoke about. It can be your surgery, the patient care management, or your post-traumatic care, stress disorders, therapies, rehabilitation, therapy procedures, and procedure training using virtual reality like tracheostomy. So with that, I would take your permission just to share a
Sure.
quick work because that will add a lot of value to the audiences as well. We have done our team has done a tremendous amount of work here and a great job in coming up with the use case and a solution considering the market trend and where the market is moving. We have done the solutions for the VR solutions for tracheostomy. The reason we choose tracheostomy was considering the amount of help it can bring in for the nurses while doing these procedures, and how the virtual environment can give the similar experience as they are doing this training within the facility itself. So post COVID, what happened was getting the training in the hospital or in the facility was a major challenge. And one of the use case, as you mentioned, and we also have developed, was the training, which most of the healthcare people are now looking at. Like, how do you enable your nurses or how do you enable your case managers with different procedures? So, keeping that in mind, this is the work we are already into and have advanced this. So we have a lot of other solutions into enhanced reality which you can call about virtual reality and um, the virtual reality and augmented reality. We have done a good amount of work in the virtual reality space, which is virtual reality based training solutions for the nursing staff and students. So this is what I was talking about, and this is the work we have done at Tietoevry Nihal.
That sounds very exciting. I get in my mind, this is going to be a game changer in healthcare.
Fantastic. Yeah. So quickly moving on to the next topic. So we spoke about digitization, we spoke about what are the different applications, and we also considering the patient experience, how we can enhance the patient experience. And because we were talking about different technologies like AR, VR, I wanted to ask you, like, it seems that the AI ML, which is again a major technology, which is your artificial intelligence or machine learning, is poised to play a big role in addressing the kinds of problems in healthcare. So I just wanted to know your views on AI/ML.
Sure. So AI ML has made gigantic progress in recent years, especially since the spectacular success that was ushered in by deep neural networks. And of course, and healthcare with so much of information already in the healthcare space is replete with problems that are particularly well suited for AI ML. But I also want to point out that AI ML requires extensive data. So it's one thing to say that, for Google to develop AI ML algorithms to say recognize cats on pictures. But when you bring in AI ML to say radiology, it's a very different and a very challenging situation. And that challenge is not just detecting whether there's pneumonia on a chest X-ray or lung cancer in an MRI. The problem with radiology, for example, is that it's not just recognizing a cat in an image. The system has to be trained to recognize all animals. The radiologist today has to recognize all diseases on a DICOM. It's not just saying whether this image has pneumonia or not. It may not have pneumonia, but it could have lung cancer. All of that has to come in for a radiology. So it becomes very difficult to get an AI ML solution working, say, in the radiology space. The other thing that when you talk about AI ML in medicine, is not just, in an airline, it's okay to apply AI ML to predict, say, how many people are going to fly on a flight from, say, New York to London. If your AI ML is off and you have, five extra people that show up for the flight at the time of the door closing, then you just, you can just deal with those five and offer them others. Another seat on another plane. Likewise, if you underestimate, they're just, you fly with three empty seats on their flight. No big deal. You can't get it wrong in AI, in medicine. The chance for you to get something wrong on a radiology image is very low. So not only does your application have to be, have to get everything correct, unlike a human being, which sometimes gets it wrong, you cannot program incorrectness in an application. So that makes it very challenging, for introducing, say, AI ML in radiology. But does that mean it's a dead end? No. There's a lot of research that's taking place today, and in the next few years we will start seeing more of this kind of technology. Perhaps not reading an image by itself, but in a decision support area where it can help guide the human being to look for certain things. So I see a lot of value there in AI ML, but it has to be used correctly. So when every one of us are evaluating the value of an AI ML application in our commercial enterprises, we got to evaluate the payoffs very closely and understand how it can be brought in. And if you do that carefully, you can get some outsized payoffs in your application.
Fantastic. So you spoke about like how the commercial enterprises and healthcare organizations, and there are some problems hiding all over the places, right? You also said hiding all over the places for which simpler applications have outside the payouts for the patient care. So can you just elaborate or give an example to us and the audience here?
Yeah, sure. So look at online schedule. Look at the scheduling of a routine healthcare visit with your doctor. Today, all of us are very comfortable with making airline reservations, making concert reservations. If you want to go see a cricket or a basketball game, we all know how to make that reservation online. So why when it comes to healthcare, when you got a cough or a cold and you want to see your doctor, that you have to go through a phone? It's not like the agent on the other side is giving you some medical advice or something very sophisticated. They're just finding an empty slot for you where you can come in. Something like this can be done very easily with an online scheduling system in medical facilities, doctors' offices, hospitals, but you don't see them today. And you just don't see that anywhere. So that's a low-hanging fruit that can easily be something that that can offer tremendous value to a patient, when they're making simple things as their routine, or even appointments with specialists. Why can't that be an online scheduling system today?
Great. Yeah, that was a great example. I agree on that. There are a lot of challenges still today on online scheduling, getting the check-in process into the clinics. So that's still a challenge. Agreed on that. So just to summarize, we started with the healthcare journey, and then we also spoke about the patient experience, which is a main area which we everybody has to focus on. We also touched upon different technologies like AI, ML, and AR, VR. So considering all this, because we are towards the end of this our given time, what are some of the things you think we will see in next 2 to 5 years where each one of us has to focus on?
Yeah, absolutely. So I feel that digitization of healthcare is just in its infancy. There's going to be some game-changing, paradigm-shifting things, not just small evolutions. That's going to take place. The online scheduling, in my mind, is a simple evolution of something that exists, but we're going to see some massive changes. So let me illustrate that with some numbers, and just to give you a sense as to how important that market is. So look at this picture right here. This is 1960, but you can extrapolate a little bit to say the 2020. But one of the things that will strike you right away is that the older population has is much less than the younger population. By 2060 or by 2030 or by 2040, as the next 5 to 10 years, we're going to see a dramatic change in that demographic. The population that's going to be above 60, 65 is going to be as large as the population, the Gen Z, the baby boomers, the Gen Zs, the ones that basically have a iPhone in front of their eyes as they're walking down the sidewalks of major cities. That population is going to be not only going to be the older population here, but that entire population is going to be digital savvy. So we have to take advantage of some of that. But I want to share with you another example that, in my mind, is a game changer. Today, look at a company like Uber. Uber is a technology company, yet it has ushered in a gig economy. It has ushered in a way in which individuals can bring their services to help the consumer to get from one place to another. So Uber is very much from our standpoints, it's very much a brick and mortar technology. We get into a car to go from A to B. Yet Uber is a completely behind the scenes technology company. They don't own any assets. Healthcare, many of you may not believe, is also a gig will also become a gig economy very quickly. So let me go back to my radiology example right here. This is a DICOM, a CAT scan that was taken from some patient, uploaded, and it can be uploaded to the internet. Today, this particular image is seen by the radiologist that's associated with the institution in which I took this particular this study was taken in. But does it have to be the case in the future? Why can't we have a gig economy consisting of radiologists? These images are put online, and the radiologist, if there's a whole bunch of freelancing radiologists can tap into that and say, of course, qualified. You got to go through that qualification process. But once you go through that, what's to say that we put it up on a website that these freelancing radiologists all over the world can pick it up and give you a reading instantly, in the next 5 or 10 minutes. I don't have to wait. Patients don't have to wait 2 or 3 days for that radiology reading to filter over through the primary care. Then you go and see your doctor or your specialist that gives you a sanitized version of this. Something like this can be just instantly, within 5 or 10 minutes, you get a reading of what's going on with it. You as a consumer, in turn, can go get a second opinion. You're not relying on one person's reading of this x-ray. So this gig economy, it has a lot of potential. In home health, the nurses are part of the organization that sends these nurses out to your patient's home. Amazon Care experimented with something recently where they were looking at a gig economy of nurses. So Amazon Care is now going to shut down, and but I can assure you that something else will come in its place in the next 2 to 5 years. So a lot of these institutions do not have to be they can leverage technology to take advantage of gig workers, people that are willing to take into account, go to a patient's home, and go to a patient's home and give them the care that they need. They don't have to come home. They don't have to be associated with a given company. They could be anyone. Now, there are challenges, of course, to getting something like this working. The professional that you want coming to your home reading your x-rays are not, you just don't want anyone and everyone looking at it, some quacks looking at your x-rays. So of course we got to vet them. They got to have the proper the training. They have to be associated with your healthcare, with your health insurance, so that they can be paid accordingly. So there are a lot of these things that have to come into place before something like this can happen. But if they do, they immediately exponentially improve the patient experience. And a lot of the companies today will become will become Uber, will become like a technology company as opposed to managing a lot of human beings. So that's where I see some things that need to keep an eye on for on the trend for the next 2 to 5 years.
Fantastic, fantastic. Because you took the example of Uber, where they collect the feedback of the customer. So that shows how customers' feedback is important. So with that in mind, I think even for healthcare going forward, as you suggested, and looking at 5 years or 3 years from now, the critical things would be like measuring the success through the patient feedback, and how do you serve the underserved patients, and the vision can be like the focus can be how do you capture the patient's voice, which is very much important. How the providers need to be better understand the SDOH, which everybody is talking about, which is your social determinants of health. And how do you literate the people on the data literacy, which is where the data becoming more critical now. So I think these are some of the points which we need to focus on.
Absolutely.
Yeah, thanks, Dr. Nihal, for your overall insight on this topic, and we completely understood. Like we also thought the thought process which you brought in, like how do you transform the patient experience? How do you enhance the patient experience through the technologies which we just spoke about? With that, let me conclude the discussion here and open this forum for the questions, in if any. So the first question which we have here is by Ram Mohan. Are there any risks that one needs to keep in mind while adopting the technology in healthcare, such as privacy, social or ethical issues, Dr. Nihal?
Yeah, so absolutely. So one of the big challenges in healthcare is the complete privacy of your information. I was, for example, when working with the radiology system and with some discussions with an army group, one of the challenges they had was they had all these different machines in different parts of the country, and they wanted to consolidate all of that. But one of the big concerns they had is that we don't want our enemy tapping into some of these DICOMs and knowing, say, our general has got some problem. So, that's obviously an extreme example, but I just wanted to illustrate that the privacy issues, security you bring something from a completely siloed application sitting on your, within the four walls of your institution, and you bring it on the web, you're going to introduce a lot of hacks, a lot of quacks, and you got to be very careful and make sure that your privacy is paramount. When you talk about some of the ethical issues, I talked about again in radiology, and not only just in radiology, but in any of these medical healthcare where you're introducing AI, um, you have to get it right. You cannot get things. You cannot be almost there. The system is going to be challenged to get it almost right 100%. You cannot bake in inefficiencies. You cannot bake in incorrectness. So a lot of the self-driving cars, when they were coming up with that same thing, how do you make it completely self-driving car. How do you, is that technology going to fly? What happens if someone suddenly, a young child crosses the road when a car is going? Today, the human being may hit the kid, may swerve, may hit a tree, but how do you program that into your self-driving application? Okay, it's not always very clear. So these challenges, these ethical questions of where do you draw the line of how do you programmatically make a wrong decision and bake it into your system, as opposed to saying I want to solve every problem, which I know I cannot, before releasing something to the to the world. So you got these ethical and privacy challenges that you have to look at. From a social standpoint, the social challenges also fit, along the same spectrum of, within the same spectrum of privacy and ethical. How much of your, when you start involving others into your healthcare, it's not just looking at your lab results, but as we talked about in the virtual reality sense, you don't want some random individual coming in and being part of that or silently observing what's going on. So a lot of these issues come together and they have to be worked on. But what I will posit to you is that these challenges are solved today. Today we have no concern about transferring money from Venmo from my bank account to yours. There's no fear that my bank account is going to be empty. So these challenges are already worked out. We just need to get it into a better space when it comes into healthcare.
Fantastic. Yes, as I would like to add to your solution, which you just mentioned, technology companies like us, Tietoevry, we are working on those challenges today, and we have a lot of solutions in the security space, in the cyber security space, because data being a major concern in healthcare. And when you talk about healthcare, it comes to my mind, it comes to everybody's mind about how do you control your PHI? How do you bring in your HIPAA if you're working for a US healthcare? How do you have the IPA in place or ITILs in place? So technology companies like us, like we at Tietoevry, are more focusing on bringing in the cyber security. How do you have your security in place? How do you control the data coming from one system to other system? Yeah. So there are solutions in place. Thanks, Ram. Thanks for asking the question, and thanks, Nihal, for addressing it. So, any other questions? The forum is open for the questions. Any other questions on the healthcare? Yeah, we have another question, like to what extent the patients are involved in digitization journey as their inputs matters to provide better solutions. This is from Santosh.
Yeah. So patients, in anything that has to succeed with the end user, and in our case, the end user is the patient. So everything works back from them. So they have to be fully involved in the digitization. You cannot come up with a strategy like, for example, let's say this is where you're going to keep your patient's health records and you're going to, keep everything there. Is the patient going to buy into that? Are they going to be happy with, keeping all their information with this particular in this particular way? What is their experience? Would they like a solution instead where they like to keep their information distributed across, the institution that took the MRIs, the lab that processed the blood results, keep it there, but then using technology such as CORS, cross-object request sharing, bring it all together in one interface. So they have to be part of that. They have to be part of that. Companies that involve the patient and take their viewpoints in place, I feel, are the ones that are going to see some successes rather than trying to jam something down their throats.
Exactly. So as similar to that, I can relate this to exactly the same as how much dependent the customers are in the customer in the other industries. Like how much do you focus on customers' experience or customer feedback or customer review? Similarly, I think even in healthcare we have to focus on the patient experience as well. So with that, we have another question from Prashant. Is it already happening in healthcare domain to have a country-specific central system to which all other healthcare providers integrate their systems for the benefit of the end user?
So no, there's no central country-specific system that people subscribe to. I think some countries are experimenting with it. In the U.S., I'll give you a simple example of the challenges facing that. It's very much at the state level, not at the federal level. So, for example, even something like when COVID was coming on, and you wanted to put your COVID, test results in place, and the Apple and Google came up with things that if you're in a population and you go out, do you see other people that have COVID, at that train station in New York City or at the game that you're going, how many other people have COVID? And all of that would come from from managing all of that through individual iPhones. So if you test positive, your phone knows it, and then that information then can be projected anonymously to everyone else's phones to know whether they are there. That's not been a success. I was very excited to see Google and Apple roll this out, but people were not very comfortable, putting their information or didn't bother, didn't care. There was a lot of problems. So even at a state level for in a pandemic where something like this was extremely critical to have, that didn't take place. So I'm not seeing any country specific. Moreover, I don't think it's going to work. Also, from my experience with healthcare, that you have something pushed down at a federal level to get some of this. I think the some of the centralization or consolidation is like in the financial industry. It's going to have to come up from the ground up. There is no government institution today that has all your financial data. It is the private industry, the financial companies that's giving it to you. So I see no real country specific, but private industry jumping into the space. And the early winners are going to be one that, like with the answer to the previous question, that bring in the patient experience, that come up with something that can scale up. That's going to be very important.
Yes. So yeah, I would also say that it's not there, and it is impossible to have a centralized system for all the healthcare. So it's very hard to bring in that. And there is an additional question, add-on question, where what are the impacts of the regulations on healthcare IT industry in coming years that you foresee, Dr. Nihal?
Yeah. So the regulations in place today are very much geared towards trying to keep your patient data secure. So we know things like HIPAA, that's in place to to keep your information protected. But there's also going to have to be new regulations that come up that dictate how information, like for example, like DICOMs. I'll give you a very simple example. Today, medical images, thousands and thousands of images are crisscrossing the web, uploaded, but these are binary files, and it's very easy to inject viruses or rogue code into some of these files. How closely are these DICOMs being monitored? I checked some of this stuff in the past, and it's quite easy to inject and quite easy to get the stuff flowing across the web. The regulations that we have, the cybersecurity, may not extend as deeply into something like medical images, which by far are in terms of volume, because a simple study is 1,000 images. A lab report is just one, a few numbers on in a table. So the healthcare industry is gonna become big time. We'll have to start acknowledging some of these gaps and building the proper regulations. But at the same time, Amazon Care failed because of Amazon Care did not achieve its objectives and is shutting down. And a lot of that is because of the way our healthcare insurance industry works in the U.S. So we got to start seeing some innovations, some changes in the health in the insurance industry, so that things can be brought to the patient in a way that the patient can be experienced. You cannot live in a silo. You cannot create a brick wall around all your medical information and have the patient on the other side of that, and there's no way to cross that brick wall. That's what the regulations are, but they have to be opened up. They have to be loosened in some creative ways to get that picture. I want to point out that the rapid introduction of the vaccines. I don't know how many of you are aware, but we had a vaccine in place in March. There were clinical trials taking place in March of 2020, I think, when the pandemic kicked in. But in 3 months of that first virus, the vaccine trials were in place before we shut down, and the healthcare industry changed regulations to shorten that cycle of getting that innovation, the vaccines into our arms. So there is a lot of potential for change there.
Yes, yes. To add on to that, I think due to this value-based care coming in, I think there were a lot of changes which happened in the healthcare IT industry. Like so many meaningful use kind of regulations came in, so which had a very positive impact in the healthcare IT industry. I agree to that, Dr. Nihal. And yeah, I we just have 5 more minutes left out, so I'll take two more questions. The next two questions, that is the next question: how can we create the health equity for a diverse population? And that
Yeah.
question is from Anita.
Yeah, so when it comes to healthcare, not everyone gets the same health, right? The care. It depends where you are, how close you are to medical facilities, how close the training that's taking place in that specific environment of your healthcare professionals, and how even basically monitoring using IT systems to monitor, whether you're given the right medicines and the right stuff. Just a quick point, in Dallas, there's a case right now about a doctor that injected some nefarious stuff into the IVs. So how do you prevent some of that? So IT can play a big role. But the digitization of healthcare, it can go a long way in simplifying or bringing down or reducing the inequity in the patient populations. If we all have access to our medical records, we're not dependent on someone who may not be that trained to look at our records. We can have a doctor anywhere in the world look at it, for example, and give us the treatment plans. So the digitization of healthcare, bringing it to the internet, the World Wide Web, the world being the focus, gives us an ability to take advantage of expertise outside our narrow domains and bring some of that in play. I talked about the example of virtual reality and how the kinds of the technologies that Tieto in fact is bringing in can help train nurses and reduce again that the inequity. A lot more people can be trained on a lot more procedures in all parts of the world, rather than saying in the big cities or in urban areas or places that have access to bringing in people, as opposed to some of the areas that are hard, difficult to reach.
Great. Yeah. Now, looking at the time, I'll just take one more last question, Dr. Nihal. It's from Darshan. It is anticipated that the United States will face acute shortage of healthcare workers, like doctors, nurses, etc. So, in next 10 to 15 years, how do you think digitization and IT can help in mitigating these issues? Maybe
Yeah.
like facilitating more remote care from overseas?
Sure. So, I mean, the COVID-19 pandemic has showed that telehealth works. In the state of Texas, telehealth was not an acceptable way to give treatment before the pandemic. Overnight, that changed. It is here to stay. You're going to get telehealth. So telehealth again gives you the opportunity to connect people in remote places with care where they are. Even in places like in the United States, we are going to be hard pressed, like you mentioned in the question, of not having doctors. But there are doctors in other parts of the world that can look at lab reports, that can look at X-rays, that through telehealth that can give us basic care all over the place. In Germany, a physician's assistant can help with a lot of routine care, and that's brought down the cost and the need for doctors. In the United States, a physician assistant cannot do that. So again, back again to an earlier question about healthcare regulations, if we start looking at the successes that other countries have faced and bringing that into different countries, we can raise the level. We can meet the challenges of shortage of healthcare professionals, and can bring a lot of stuff going in place together. We didn't have a lot of time to talk to during the question and answer. But telesurgery, robotic surgery is becoming a big time. But today, robotic surgery is taking place within the room in which the OR takes place. So the doctor is sitting a few feet away from the patient, manipulating the robo as the robot goes into our bodies and makes does that surgery. Why does the doctor have to be a few feet away? Why can't the doctor be in another city, across the continent? The internet can bring that together, so you can have complex surgery, with very skilled professionals. Rare skilled professional doesn't have to be in your city. A resident can open you up, but the specialist can be half a world away. Of course, latency is important, but latency is a problem, the delay that's taking place today in today's environment. But every day that latency gap is closing. You just have to look at the services provided by your internet providers. Every day they're boosting the amount of gigabytes that can be uploaded and downloaded to your homes. So it's going to become routine to start seeing not only telehealth with the patient talking to the doctor, but the doctor actually performing surgeries. I mean, I see some potential there also.
Great. Yeah, I think telehealth, remote patient monitoring, and your Internet of Medical Things will be a game changer, which even Tietoevry is looking forward for and working on that. And yeah, considering the time, I think we are on time. Thanks, Dr. Nihal, for your great insights. Thanks for your time this morning. Thank you, one and all the audiences who are part of this fireside chat. Thanks a lot. Have a great day ahead.
Yeah, thank you, everyone. Appreciate you listening to me and all your questions. Thank you again, Sridhar. I enjoyed being here.
Thank you. Thanks, Dr. Nihal.